Welcome to the HeyGen podcast. Today, we're diving into a fascinating study about how needles used in neuromodulator injections get deformed after multiple uses. Let's jump right in.
That sounds super intriguing. What's the main takeaway from this study?
Well, the researchers wanted to see how needle tips change when they're used repeatedly during procedures like Botox injections. They looked at how many times a needle can be used before it starts to get deformed significantly.
Oh, I didn't realize needles could deform that quickly.
Yeah.
How did they test this?
They took needles of different sizes, 30G, 31G, and 32G, and used them for injections in various facial areas. Then they examined the needle tips under an electron microscope to see the changes.
Wow, electron microscopy sounds intense.
It really is.
So, what did they find out?
They discovered that after just a few injection passes, the needle tips started to deform.
Oh no.
The more times they used the needle, the worse the deformation became.
That's concerning. Does that affect the patient's experience?
Definitely. A deformed needle requires more force to penetrate the skin,
Right.
which can decrease the precision of the injection and potentially cause more discomfort.
So basically, reusing needles too many times isn't ideal?
Exactly. The study suggests that needles should be changed after 5 injection passes to minimize deformation.
Makes sense. Did they notice differences based on where the injections were done?
Yes, they did. The area between the eyebrows, the glabella, showed the most needle damage after multiple injections.
Interesting. I wonder why that area causes more damage.
It's likely because the skin and muscles there are denser, so
I
inserting the
see.
needle requires more force, which increases wear on the needle tip.
That makes sense. So, what about needle sizes? Did that make a difference?
Actually, smaller needles like 32G had less deformation compared to larger ones like 30G.
Really? That's a bit surprising. I would have thought smaller needles would deform more easily.
You'd think so, but apparently, the smaller diameter means less surface area to get damaged.
Huh.
It's like having a thin piece of wire. It might bend less under certain pressures than a thicker one.
Interesting analogy. So, what's the practical takeaway for practitioners?
The main point is that changing needles after about 5 uses is recommended to maintain precision and minimize patient discomfort.
Got it. But wouldn't changing needles so frequently be more costly and generate more waste?
That's a valid concern.
Yeah.
However, the benefits of improved injection precision and patient comfort might outweigh those downsides.
I suppose patient safety and comfort should come first.
Absolutely. Plus, avoiding complications from inaccurate injections is crucial.
Definitely. Did the study mention anything about patient pain levels?
They didn't measure pain directly, but they noted that increased force required for a dull needle could potentially cause more discomfort.
That makes sense. So, in summary, for optimal results, practitioners should consider changing needles more frequently, especially when injecting denser areas like the glabella.
Exactly. It's all about providing the best care possible.
Agreed. This has been really enlightening. I'm sure many practitioners will find this information useful.
I hope so. It's fascinating how such small details can make a big difference.
Absolutely. Thanks for sharing this study with us.
My pleasure. Can't wait to discuss our next topic.